The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the Weymouth Community Access staff or its board of directors. WCA, in compliance with FCC regulations, is prohibited from exercising control over the content of independent member-produced public access programming.
It is my privilege and honor to introduce our speaker. He started coming to a couple of our public video showings in Quincy, Massachusetts. The second time, it was a showing of America, Imagine a World Without Her, Denise D'Souza. And now he tells an interesting story of how he got caught. He got in some kind of violation with some legal issue. And when Dr. Kishore met him, he said, I have a story to tell too. And about a week later, he called me, and we got together, and he told me a story. And he gave that story here last year, about this time, a year ago. That's where he became very good friends with our late friend Sam Blumenfeld, and they traveled around the state doing some forums together. And he got to some, well, we won't discuss that at this meeting here. But about a month ago, HBO had a series, a special documentary. It was called the Heroin Cape Cod USA, Heroin Addiction USA, or something like that. And it was, I didn't get a chance to see it, but except excerpts of it, but it was quite interesting that we are having a heroin epidemic, not just in Massachusetts, but around the country. So I thought I'd bring him here to discuss that topic. And Dr. Kishore is from India. He came here in the early 70s, and he is perhaps the world's top addiction specialist.
Wow.
An MD, and I'm going to try this one, a distinguished fellow of the American Association of Addiction Medicine. I think I got it right? So it is a privilege. Let's give him a nice warm welcome.
Hey, put your fat head out of the way.
Sorry.
Thank you, Hal, for that nice introduction. And it's a real privilege and honor to be here with all my good friends and supporters. I truly enjoy joining the society events and be part of it. I think we're all kindred spirits here. And at this day and age, we have this problem, the heroin epidemic in Massachusetts. People have been reading about it in the newspapers, seeing
I'm
it.
sorry, sir, could you speak into the microphone a bit more? Is that mic turned on?
This is a mic for the cable, not
Okay. Could you speak up a bit?
Sure. So, right now, we are beset with the heroin epidemic in Massachusetts, and Hal asked me to address the whole issue of what's happening, where are the solutions. So I put together a quick slide kit, and let's see if we can go through it. There are three important words here: heroin, epidemic, and Massachusetts. Heroin has been here since 1895. It's not a new drug. It's been here since 1895. And we brought it into the country from Germany in 1895 to cure morphine addiction. And that's how it came into the country, as a cure for morphine dependence. Morphine came into the country in 1862 when we had the Civil War, and the soldiers were injured, and they were given heavy doses of morphine to help with the pain. So morphine addiction was called the soldier's disease in 1865-70 when the soldiers came back. They all came back with soldier's disease or morphine addiction. And that continued for 30-40 years. When we began to feel it's out of control, we brought in heroin. In 1914, the society had enough with it, so let's banish it. We banished heroin from the shores of the USA. And that did bring a little bit of control, but it's always been there in the subsurface. It's endemic. It's not an epidemic till recent times. What is addiction? The definition is pretty broad. If you look at my society definition, this is a short definition. The original definition is at least 2 pages long, so they condensed it to a couple of paragraphs. Even then, it's a hard thing to follow. If you read it through, addiction is a primary chronic disease of brain, reward, motivation, memory, and related circuitry. Everything we do in our life involves brain, reward, motivation, memory, and related circuitry. So, in what way is it different? A dysfunction in the circuit leads to characteristic biological, psychological, social, spiritual manifestations. Everything we do in life can have the same effects. This is reflected in the individual pathologically pursuing reward and/or relief by substance use and other behaviors. Too broad. Addiction is characterized by inability to consistently abstain, impairment in behavior control, craving, diminished recognition of significant problems with one's behavior, interpersonal relationships, and a dysfunctional emotional response. We have that to many other situations in our life. Like other chronic diseases, addiction often involves cycles of relapse and remission. Without treatment or engagement in recovery activities, addiction is progressive and can result in disability or permanent premature death. This is the 2016 definition. Does this definition make any sense? It's too broad, too vague. It's very hard to really pinpoint and figure out what's happening in the addicted person. I think this is a much simpler definition. Addiction is a conundrum wrapped in a mystery, buried in an enigma, and shrouded by secrecy. So this is what, when people go to AA meetings, that's what they call it. It's complex and hard to understand. It's a bit of a mystery. Why it happens, how people get addicted, how do people get de-addicted, why some people relapse, why some people don't relapse, why some people die, some people survive. There are a lot of mysteries about addiction. And AA has much simpler principles. You're powerless over it. And it's worked for many, many years, since 1930s. The Alcoholics Anonymous has been the mainstay for addiction treatment, and they have tremendous success to report. So we got to make things simpler for people to get a grasp of it. But the definition that the society put out is too complex and hard to understand. So we look at the principle, energy equals mass into constant square, explains all the things we need to know about energy and mass in the universe. So good definitions are simple. So we have a very complex definition which is hard to implement, hard to figure out what's going on, and are we looking at the right tree? If we ask a fish to climb a tree, it can't do it. And it's the same way with the addiction arena. It's a very powerful addictive substance, and it's dangerously addictive. It comes as a brown powder or a white powder. It's pretty cheap now in all the communities. It's available. We are at a dangerous level of addiction with the substance. And the youngest patients are 8-10 years old. At the age of puberty, a lot of them are experimenting with heroin, they sell it as cheese, which is a little bit of heroin with melted Tylenol. They make it into little cheesy pieces. And that's what the kids are getting for $1 a piece. So it's a way to hook them into the addiction world. It's in every community. It used to be very much an inner city problem. When I first started in the addiction world in 1977, I was the medical director for the Washingtonian Hospital in Jamaica Plain. And at that time, we hardly saw heroin addicts. Mostly we treated alcoholics. So by 1990s, we had an epidemic with OxyContin, a powerful narcotic, which was pushed by the pharmaceutical companies and given by the doctors to patients. And that's what led to the heroin epidemic right now we're seeing in early 21st century. So we have a problem here with the confusion about definition, what to do, what not to do, how best to treat, how not to treat. Each person has their own opinions. We don't have a tried and trusted path out of this epidemic. In general, when I came to this country, it was sporadic. There were cases here and there. We would see a case, but it's not really a major problem. Then we had the OxyContin epidemic in the late 90s, and then heroin was there, it was a substitute for OxyContin, but it's not very big. And by year 2010, it's penetrating all the communities from the inner city. Right now, is it an epidemic or a pandemic? We are between a spreading epidemic or a pandemic. So epidemics occur in over a period of time. They occur in excess of the expected rates. In a pandemic, it's in several countries, continents, affecting a large number of people. And that's what we are seeing now. It's affecting Canada, it's affecting Europe, it's affecting some of the Asian countries, Australia. We have had case reports from all these countries. So it's a pretty serious issue here. If you look at the epidemics in history, smallpox, of course, is the biggest, with 300 million people who passed away. Measles, Spanish flu, and of course the bubonic plague. We have estimates of approximately 75 million people who perished from that. So addiction is getting into one of these realms here, between HIV. It's tied together with HIV, so we have a problem somewhere in between that. But in reality, all the other diseases are from infectious agents. It's an identifiable agent that's causing the disease. Whereas with addiction, we still cannot say, is it the person, is it the substance, or is the environment that's causing the disease, or all three? Obviously, it's all three. It makes instinctive sense. It's not, person has to be vulnerable, the drug has to be available, and it should be used in a way that becomes addictive. So we have all three angles of the triangle, and it's right now rolling through all our communities. Just to give you some numbers, it's very hard to get good numbers. This is not an infectious agent. We have to assume certain things. Denial is part of the disease, so people do not have good numbers. So it's all guesstimates here. We can see the skyrocketing use along with the skyrocketing death rates. And in our communities in the Northeast, it's really galloping compared to the South and West. The problem here has been multiplying at a very rapid pace. So obviously we need to do something, but what is it that we should do? And that's where we are not able to make much progress. Once again, the statistics are here. They're self-explanatory. And the age is 12, and many drugs are in the play. Down below are the list of drugs in the drug bazaar. PCP is also called angel dust, marijuana, inhalants, LSD, cocaine, so on and so forth, barbiturates, heroin, sedatives, tranquilizers. All of these are pushed onto the young fellas. So these people are starting their addictive careers at, I'll say 12, 13. So it's a huge problem here. The youth of the country is getting affected. The backbone of the society, the young adults. We can once again see the heroin skyrocketing. Opiates are they're trying to control it by having the physicians write less prescriptions, but that has resulted in a heroin epidemic. Massachusetts is yellow to orange. It's getting from lower to the higher levels of addiction. Once again, the numbers are suspect. We don't have good data. So we've got to work with what we have. This once again, it's Boston is about 13.83 people per 100,000 passing away in 2014. We are 2 years behind already with our numbers. We can see the brown, dark brown, and the yellow colors across the state. And in the rural areas, we don't have good numbers. So we have to assume we have a statewide problem here. And how do we tackle this? We cannot do it by just having a neighborhood or a small township get clean. We've got to do it as a statewide problem. And this once again is where we are missing our targets. So we can see the 2015 approximation is 684. I think it's more like 1,000 now according to the most recent data. This is the known deaths that have been examined and proven. That for every one case that they have, there are many cases that are not diagnosed. So we have a hidden epidemic here with an iceberg phenomena. We don't exactly know the extent of the issues. And for the past few years, they have not kept good statistics. So we are working with incomplete data. We're trying hard with varieties of drug courts, drug-free communities, drug courts, high intensity drug trafficking areas. Varieties of approaches are being adopted. But in reality, Tom, you want to pass on the first one?
This one.
Yeah. If you look at the graph, there's been a study of what happens with an addicted person over a period of time. We can see, if you look at the graph, that if you follow people over a period of time, what they say in AA is very true. Jails, institutions, and death. Out of 100 people who get addicted, about 23 people will make it to safety and stay safe over a period of time. But about 48% to 50% will perish. They die from their own hand or from somebody else's hand, infections, and overdoses. So it's a huge curve of people who do not survive over a period of time. So this requires an urgent approach. We got a problem where the youth of the country are getting addicted at a young age, and the lifespans are shortening by at least 20 years. If you live in the society for 74 years on the average, addicted person probably has about 20 years less of that lifespan. So we need a different approach. Jails, 4% of them stay in jails, and vast majority are using a little bit here and there, and they are trying to survive by chipping or using a little bit. So we have a major epidemic that requires different solutions. It's not work, what we are doing. So the approach I adopted in my practice, I practiced vigorously with many communities from 1991 to 2011. During the time, I adopted a public health approach, which means many small practices over a large geographic area. We made it into a primary care approach. Addiction is considered a mental health problem by many people. So they have to see the psychiatrist or psychologist or social worker or go to a mental health hospital to get care. That's an expensive proposition. It's very hard to do it. So you got to adopt a primary care approach. You got to do preventive medicine approach, which is difficult for doctors to adopt to. Doctors treat a disease after it comes to the notice. It's very hard for them to take care of patients before the disease happens.